Bismillahirrahmanirrahim. Assalamu alaikum. Today I will talk about lung volumes and capacities in theory exam. Sometimes you will face a question of physiology of lung volumes and capacities, usually which we are measuring on the spirometer. So you have to memorize the volumes and capacities. Actually, you need some concept and also you have to memorize before you are going to appear in the exam. So I will try to help you to how to memorize it. There are four volumes and four capacities. The four volumes, the first is tidal volume, inspiratory reserve volume, expiratory reserve volume, and the residual volume. Tidal volume TV, inspiratory reserve volume IRV, expiratory reserve volume ERV, and the residual volume. So this is the residual volume. I make it yellow, and also the total lung capacity. I will let you in the next slide why I make it different color. Just keep in mind these two are easy to memorize. So here the difference is these are the reserve volumes, and here the last is residual volume. So residual volume remains same in the lungs. You cannot remove it, even though you will remove the lungs from the body and you will jump on the lungs, but this volume remains inside the lung. That's why it is the permanent residence in the lungs. So that is called the residual volume. So I'm repeating volumes, which are four: tidal volume, inspiratory reserve volume, expiratory reserve volume, and residual volume. The capacities are four: the vital capacity, the inspiratory capacity, the functional residual capacity FRC, and the total lung capacity. Vital capacity is always vital. Never forget about vital capacity. I will tell you the definition in the next slide. Inspiratory capacity and functional residual capacity. This is also important in spirometer. FRC and VC also, when we measure it, if it is force, it will call the FVC, forced vital capacity. Otherwise, vital capacity, inspiratory capacity, functional residual capacity, and the total lung capacity. So four volumes and four capacities. So what is the difference between volume and capacities? Actually, volume is measurable. We are measuring on the spirometer. But capacities, it is calculated. You will calculate it. You will not measure it, but you will calculate it. Means if I am saying I will give you the number 2. So this 2 number alone you cannot calculate. Definitely you need some other number like 2 plus 1, 2 plus 5. Then the 2 numbers you can calculate. So same here, the volumes, these are the one, when we calculate 2 or 3 volumes, it will be the capacities. So this is the difference, and the volume is the measurable and capacities are calculatable. So it can be calculated, it is not the measurable. So tidal volume, what is tidal volume? Usually in adult, which are different, but I will talk about the pediatrics. 6 to 8 ml per kg is the tidal volume. And the tidal volume, like you are in the resting position now, and you are breathing in and out. So what we measure in the volumes, we are measuring the gas which we are taking in and out. We are taking in oxygen and we take out carbon dioxide. So these gas, we measure the volume of these gases. And tidal volume is amount of air inspired and expired at each breath. Means normal resting position when you are breathing, that is called the tidal volume. Then the inspiratory reserve volume, from the word you can recognize inspiratory I or V, reserve volume, the amount of air that can be inhaled at the end of normal tidal inspiration. So for example, you are taking a normal breathing in and out. You inspire and after inspiration again you try to forcefully inspire again as much as you possible. That is called the inspiratory reserve volume. So this volume is reserved in your lungs, but you don't use it. But when you inspired forcefully, like after a tidal volume, normal breathing, that is the volume which we call inspiratory reserve volume. Expiratory reserve volume, again from the word, what after normal quiet expiration, as much as possible you can remove the volume from your lungs, that is called the expiratory reserve volume. And the residual volume of the air that remains in the lungs at the end of maximum voluntary expiration. So voluntary expiration, forceful expiration, whatsoever you do, after that the volume remains in the lungs, which is called the residual volume. So these are the volumes. Then we'll go for the capacities. Vital capacity, it is sum of inspiratory capacity and inspiratory reserve volume. So this is the maximum volume of air that can be expired after a maximal inspiration. It's the maximum volume of air that can be expired after a maximal inspiration. The difference between here, and if you will see the inspiratory, here it is after tidal inspiration, but here if you will see maximum volume of air that can be expired after a maximal inspiration. So you did maximal inspiration, after that you will throw out the gas as much as you possible. So that is called the vital capacity. This is a sum of calculation of inspiratory capacity, which is the inspiratory capacity plus inspiratory reserve volume. I'll show the spirometer in the next slide so that you will understand well, and I will repeat also this one. I want you to memorize it, because sometimes only you will get these definition in the different way, but if you will know these definition, it will be easy for you to understand. And sometimes they will give you the spirometer trace and how to recognize from spirometer trace. So the second is inspiratory capacity, which is tidal volume. Tidal volume, as you know, at the each normal breath when you inspire and expire, that is tidal volume, plus inspiratory reserve volume, that is called the inspiratory capacity. Whatever capacity inside your lung when you inspire, during inspiration, after tidal volume you inspired, that is called the inspiratory capacity, which is the maximum volume of air that can be inspired at the end of the normal tidal expiration. So that is the inspiratory capacity. The third is functional residual capacity, FRC, which is residual volume plus expiratory reserve volume. So this is the residual volume and expiratory reserve volume. If you will calculate both of them, that is called the functional residual capacity, FRC, volume of gas remaining in the lungs after a normal tidal expiration. Usually this is the reserve capacity. We use it when we need it, like for example this is reduced in when you lying supine during anesthesia or sleep. And there is also importance of these residual FRC in the patient who is babies who are preterm and they are grunting. This FRC is affected. So in small babies, FRC is not that much, so that's why they are easily tired, and this volume is important. This capacity is important. So the total lung capacity is very easy. All amount you will calculate, that is called the total lung capacity. The definition is maximum amount of air lung can accommodate, total volume of lung following a maximal inspiration. So the TLC is sum of IRV, inspiratory reserve volume, tidal volume, and expiratory reserve volume, and plus a residual volume. So this you will calculate, that is called the total lung capacity. Or the second is vital capacity and residual volume. In vital capacity, all three would be there. In vital capacity, all volume, tidal volume, IRV and ERV. The remaining is the residual volume also. It's not included in the vital capacity. So that's why vital capacity plus residual volume will be total lung capacity. So this is the spirometer. So these are the 4 volumes and 4 capacities. This is when curves goes up. When we inspire, the curves goes up. When we expire, the curves goes down. Okay. So this is the tidal volume, which is normally a person is breathing normally. This is the tidal volume, in and out, in and out. But here what happened after the normal expiration, the inspiratory reserve volume, when person during normal tidal expiration, he again inspiration, at the end of inspiration he again forcefully inspired, so that is called the inspiratory reserve volume. And again when tidal volume came, and again after expiration he again forcefully expired the gas, that is called the expiratory reserve volume. So these are the, when we calculate from here inspiratory reserve volume, tidal volume and expiratory reserve volume, that would be the vital capacity. This is the very important vital capacity, the FVC and FEV 1 second. So this is the forced exhalation after a deep breath, that is the FVC, forced vital capacity. And there is a relaxed vital capacity and forced vital capacity. Forced vital FVC, when we use spirometry, we use the FVC and FEV 1 second. So what is the difference between FVC and FEV 1 second? I will talk about after these capacities. So now you know about these four volumes, about the capacities. Inspiratory capacity, which is of IRV, inspiratory reserve volume, and tidal volume, that is called inspiratory capacity. Then FRC, functional residual capacity, which is expiratory reserve volume and residual volume, that is called the FRC. This is actually reserve volume, when we need it we use it. So the vital capacity as we discussed, and then the total lung capacity, the sum of all is the total lung capacity. Usually in spirometer, residual volume we cannot measure, and residual volume there are some other methods which can be used. First of all, there is some calculation you will exclude out after this measurement. The other thing by gas dilution method or plethysmography. So this is the different topic we use measure the residual volume. Okay, now about the vital capacity, as I told you, the vital capacity is the vital. So, for example, if you throw a stone from a stone in your hand, and you are throwing throw as much as fast you can, the power you are giving to the stone till stone is in your hand. When you release the stone, the power of your force will be disconnected. Then the stone will go by itself as much as fast you throw the stone. So like in the FVC and FEV 1 second, this is the example I give you. For example, FVC is the forced vital capacity, as much as a person is giving the force to exhale, that is the FVC. But then we will measure in the 1 second how much it is in the 1 second. That's 1 second is independent of the force, so the remaining force is not there, the force of the patient is not there, but this is the already patient has through the air, exhale the air. Then you will measure in the seconds, 1 second, 2 seconds, 3 seconds. So but the FEV 1 second is the important, so that's why they are call it FEV 1 second, forced vital capacity and forced expiratory volume in 1 second. So these are the important to know about the restrictive and obstructive lung disease. Like for example, the normal ratio is the 80%. But if patient is restrictive lung disease, FEV1 and FVC ratio is more than 80%. If it is obstructive lung disease, FEV1 and FVC ratio is less than 80%. So this was about the effect of bronchodilators. The other thing we measure the effect of bronchodilators. For example, a 10% or for example 15 to 20% increase in FEV1 and FVC. Then this is the significant. Then we will say that this patient might have some obstructive disease, so that you give the bronchodilators, and after bronchodilators there is more than 10% of increase in FEV1 and FVC ratio. So this is the one way to diagnose of asthma. So these are the values. I don't want to tell you about the pathology. I just wanted to know about the physiology. There are some examples I have given you only. Thank you very much. Assalamu alaikum.